I'm Dr. Kenneth Levine. Welcome back to Health Talk. You can see us now streaming live on the web at www.tvchannel19.com, or you can see us on any iPad, iPhone, whatever you want to see our show. My guest, I'm going to show you a picture, and then you may get a hint. This is Jesse. Jesse was my soft-coated Wheaten Terrier. Jesse, unfortunately, has been gone for 7 years, but we have his picture next to my desk in my office and next to my bed at home. I'd like to introduce Dr. Donna Schwartz. Donna is a veterinarian in Coral Springs, and Donna, I'm so glad you're here because as Jesse was so dear to me, and still the memory is incredibly tender and loving, I know that most of our friends, most of our patients who have pets feel the same way. Welcome.
Thank you. Thank you for having me.
So tell me a little bit, how did you become a veterinarian? Why did you want to become a veterinarian?
Well, I can honestly say that it has been a lifelong passion for me. I grew up in Philadelphia, and my mom used to breed boxers, and we used to show them. So I was exposed to the veterinary profession at a very young age. I mean, probably around age 3 or 4. And when you used to tell people when you're 3 or 4 years old that you want to be a veterinarian when you grow up, you know, they would say, well, every kid does, and good luck with that, you know, kind of thing. But I really stuck with it and pursued. I was kind of hooked from the very beginning. So I worked hard all through school and got scholarships to college because that was really the only way I was going to be able to go. And I continued to work hard and, you know, pursued what I wanted to do for so long and kept at it and kept with it despite being, you know, it was very difficult to get into veterinary school because at the time I was applying there were so few schools available that I had access to, right. Essentially.
You know, it's great to have a focus from a very young age because you have a goal, you have something to work for. Relative to gender in the veterinary profession, how is it relative to men and women as far as percentage, and is that changing?
Well, there are far more women in the profession now than even before. So, you know, we have intern classes coming in all the time at the practice that I work at, and they're predominantly women. I mean, the classes historically for the last, probably for the last 15, 20 years or so have been predominantly women. It used to be a male-dominated profession, and now it's, you know, switching to the other gender.
That's interesting because when I was in school, there were 3 women out of 104. Mm-hmm. Now, more than 50% of the classes are women, and in some countries, I spoke with somebody from Panama, 90% of their classes were women years ago.
Yeah.
That's a terrific thing for women. Mm-hmm. How does one decide what they want to become, like a big animal vet, like horses and lions and tigers, or a little animal vet like cats and dogs?
Yeah, I think it really depends on your exposure and how you're brought up. I mean, I was always focused on small animal because I was from the city, so that's really what my exposure was. And then in vet school, you know, I was exposed to the large animal side, which in the beginning was very intimidating because they're huge and they can do a lot of damage to you if you're not careful. But then, you know, I think I know of people that knew that they wanted to be small animal veterinarians, and here they are today, large animal veterinarians, and vice versa. So I really think, you know, there's either something that inspires you while you're in school or the exposure that you have prior to or during that really, you know, keeps you on that, whether you want to do large or small, or some thorough practitioners out there who do both. So.
No, I trained at the University of Pennsylvania, and there was a root canal specialist who had to go to the Philadelphia Zoo, mm-hmm. and he brought back an x-ray where he did a root canal on a tiger, and you know, the tiger's head was gigantic, and they had to actually create some instruments to try to get to the bottom of the tiger's tooth. It's my understanding that there are veterinarians who do a lot of work, a lot of dental work for animals. Yeah,
there are boarded dental surgeons and veterinary dentists and oral surgeons that do a lot of those things. I mean, we have a boarded dentist who comes to our practice, you know, once a week, who is doing amazing things, you know, things that you would never consider doing, you know, before. I mean, root canals and crowns and, you know, a lot of reconstructive surgeries and whatnot.
We're going to get back to that in a moment. We're going to come back with Dr. Schwartz in a moment. Again, I'm Dr. Kenneth Levine with Health Talk, and we'll see you in just a couple of minutes. Thank you.
You come